In a world still grappling with the aftermath of the COVID-19 pandemic, health officials issue a chilling warning. It's not an exaggeration to say a disease X event is just around the corner. The head of the World Health Organization, or WHO, warns that the next pandemic could be even deadlier than COVID-19. Disease X is a term the WHO uses to describe a hypothetical, unknown pathogen that could cause a future epidemic or pandemic. The term was coined in 2018 as a placeholder for any disease that is not yet known to cause human infections but could potentially emerge and pose a global health threat.
The threat of another variant emerging that causes new surges of disease and death remains. When the next pandemic comes knocking, and it will, we must be ready to answer decisively, collectively, and equitably.
The WHO introduces Disease X, a term representing a disease yet unknown to medical science, a potential harbinger of a devastating pandemic. It also added Disease X to its list of priority diseases requiring urgent research and development. Experts agree that the next pandemic is likely zoonotic, originating in animals before infecting humans. But zoonotic outbreaks are not the only concern. Bioterrorism and the release of engineered pathogens could also pose catastrophic risks. As the world faces an uncertain future, it's essential to be prepared. Are you ready for the next pandemic? Preparing for the unknown requires a comprehensive approach that combines surveillance, research, and global cooperation. The World Health Organization has launched the International Pathogen Surveillance Network, IPSN, providing nations with access to genomic sequencing to identify and respond to emerging disease threats. Genomics allows scientists to deduct mutations that can make a pathogen more infectious or deadly. According to the World Health Organization, the COVID-19 pandemic has to date killed almost 7 million people worldwide. Updated negotiations on international health regulations are crucial to ensure better preparedness and response to future pandemics. We must be ready to answer decisively, collectively, and equitably when the next pandemic comes knocking. But it's not enough to rely solely on scientific advancements. Preparedness at the individual and community levels is crucial. Stock up on essential supplies and maintain a well-equipped emergency kit. According to the World Health Organization, individuals should have at least 2 weeks' worth of food, water, and medication stored. Stay informed about potential disease threats. Follow official guidelines and have a plan in place for various scenarios. The World Health Organization recommends staying updated through reliable sources such as national health agencies and the WHO website. Conduct regular drills to ensure everyone knows what to do in an emergency, and emphasize the importance of good hygiene practices. Practice proper hand hygiene, respiratory etiquette, and social distancing measures. Building community resilience is vital for a collective response to a pandemic. Create community networks and support systems to share information, resources, and support. Foster a sense of community by organizing events that promote social connection while adhering to safety measures. Encourage outdoor activities that allow for physical distancing, such as community gardening and exercise classes. Support vulnerable populations by providing essential supplies and resources to those in need. In the COVID-19 pandemic, an estimated 47 million people were pushed into extreme poverty, disproportionately affecting women and children. By assisting vulnerable communities, we can help mitigate the impact of future pandemics. Remember, each dollar invested in pandemic prevention today can save billions in the future by averting the impact of a major outbreak. According to a study conducted by the World Bank, investing $1 in pandemic preparedness today can result in a cost savings of up to $3.70 in the event of a global outbreak. Establish neighborhood emergency response teams to ensure a coordinated and efficient response during a crisis. According to a study published in the Journal of Emergency Management, communities with organized response teams experienced a 50% reduction in mortality rates during disasters. The fight against pandemics requires global collaboration and cooperation. No country can face these challenges alone. The fight against pandemics requires global collaboration and cooperation but it also demands financial investment. A report by the Coalition for Pandemic Preparedness Innovations stated that the world needs to invest at least $4.5 billion a year in pandemic prevention to avoid future catastrophic outbreaks. The report emphasized the importance of funding research, surveillance systems, and the development of medical countermeasures. Participate in international conferences and initiatives to share knowledge and resources for pandemic preparedness. The World Health Assembly, consisting of representatives from 194 member states, plays a vital role in shaping global health policies and strategies. Collaborate with scientists and researchers worldwide to develop innovative solutions and advance medical science. The Global Virome Project, a global effort to identify and characterize unknown viruses, aims to prevent future pandemics by better understanding the viruses circulating in wildlife. Support international aid efforts and contribute to the global response by providing medical assistance and supplies. The United States alone pledged $4 billion in funding to support the COVAX initiative, which aims to provide equitable access to COVID-19 vaccines for low-income countries. As we face the uncertainty of what lies ahead, remember that we are stronger together. The next pandemic may just be around the corner, but with collective efforts, we can mitigate its impact and save lives. We can face the unknown with courage and resilience by staying informed, preparing at an individual level, building resilient communities, and fostering global collaboration. Investing in scientific research and surveillance systems is vital for early detection and response to emerging diseases. The WHO's international health regulations require countries to report outbreaks of certain diseases, ensuring a timely global response. Dr. Sarah Thompson, a renowned public health expert, highlights the long-term benefits. Investing in pandemic prevention is a proactive approach that saves lives and helps protect economies, maintain social stability, and foster global prosperity. Promote health education and awareness in your community. The WHO estimates that up to 1.6 million lives could be saved annually through simple preventative measures such as hand washing, vaccination, and safe food practices. Emergency preparedness should be integrated into our daily lives. According to a survey conducted by the American Red Cross, only 17% of respondents reported feeling very prepared for a disaster, highlighting the need for increased awareness and action. Developing antiviral drugs and therapeutics is crucial to treat individuals infected with emerging pathogens. The COVID-19 pandemic has shown the importance of developing effective treatments to reduce the severity of the disease. Prioritize self-care and mental health during challenging times. The psychological impact of a pandemic can be profound, and seeking support and practicing resilience can help individuals cope with stress and anxiety. Thank you for joining us on this journey of preparedness. Remember, the next pandemic may be just around the corner. Stay prepared and stay safe.